I'm Mark Netherda. I'm the Deputy Health Officer for the County of Sonoma. Swine flu is a novel type of influenza that's circulating right now in people kind of around the world at this point. It's different from other kinds of influenza in that it's never been seen in people before. This particular type has been seen in pigs before, but it's never actually been seen in people anywhere in the world. The risk of getting swine flu is pretty much like getting the regular seasonal flu if you come in contact with somebody who has the flu. So at this point, with no cases confirmed or even probable cases in Sonoma County, the risk right now to contract the flu in this county is very low. The factors that influence the severity of the flu aren't completely clear. We do think that this flu, like other flus, should be more virulent, or the disease would be worse in people who are either already very sick or in the very young or in the very old. However, that's not consistent with what's happened in Mexico. This flu's been circulating in Mexico, and there many people who have been otherwise healthy have actually gotten sick with the flu, and some have died. It's not clear why people in Mexico are dying and people in the United States are not. It may be that there's some other factor that we have yet to discover, or it may be that there just haven't been enough cases in the United States, and that this is being controlled well enough in the United States that hasn't occurred. We're still, very carefully monitoring the situation. We believe that there have been so many cases in Mexico that went unreported that there's probably a lot more people who had it, and that would actually bring the death rate down, but it's really not clear at this point. At this time, the United States has put out some recommendations about traveling to Mexico. They're available on the CDC website under travel advisories. With this flu, if people have symptoms of influenza, which include fever, cough, sore throat, in some patients with this particular swine flu, there's been nausea and vomiting along with the fever, general body aches and fatigue, we'd recommend that they talk to their healthcare provider, call their doctor. We don't think people should be running off to the emergency room. This flu does not appear in the United States to be any worse than the seasonal flus that we've had, so emergency rooms should be used by those people who are extremely ill or having shortness of breath. Anybody who's sick with an influenza-like illness should be isolating themselves, not going to work, not going to school. Kids will need to be kept home from school if they're sick so that we don't spread this, just in case anybody does have swine flu out there. The Department of Health Services has a plan for dealing with a flu like this, and we put that plan into effect and are doing our best to meet all the needs and utilize as many resources as we can to get information out to people and get the proper people tested and get people into care if they need it. Again, there haven't been any cases in Sonoma County, so we're ahead of the game, but that's exactly where we want to be at this point. And if people have questions or concerns, they should call their doctor.